the National Senior Director of Health Promotions, and I focus on lung diseases. Today, we're here to talk about interstitial lung disease, and so I'll set the stage for that and then turn it over to one of my colleagues who's going to dive into interstitial lung disease, and then I will come back to close out the meeting talking about some resources available from the American Lung Association. It's important for me to begin by reminding you all that we can't give medical advice during this webinar, and you should always consult your personal physician or your healthcare provider if you have any questions. We can't talk generally about chronic lung disease and interstitial lung diseases, and that's what we plan to do. If you have specific questions, we might be able to follow up with you on a more one-on-one basis after the presentation. We have your email because that's how you use that to register for the webinar today. So I'd like to start with thanking you again for joining the webinar. And the American Lung Association for over 115 years has been the champion of healthy lungs and healthy air. And we know that our work is super important, especially today when we're dealing with a pandemic and all of the other chronic lung disease that we're working to prevent and then also to help manage. We know that there's climate change issues relating to wildfires and hurricanes, and that there continues to be an epidemic in tobacco and youth using tobacco. There's so many things that the Lung Association has taken part of, certainly not least of which is to continue to fund that life-saving research that is addressing air quality, tobacco use, and chronic lung diseases. And so we are steadfast in our mission of saving lives by improving lung health and preventing lung disease, and look forward to talking a little bit more today about our main topic. This is a Better Breathers This is a Better Breathers Network meeting, which means you've signed up to get some additional resources from the American Lung Association, and we're trying to make sure that the resources that we're providing are what's most useful to you. At the end of this webinar, we'll probably follow up with you with a survey that says, was this helpful? Do you have any other topics that you want covered? Is there anything you'd like to be done differently? And the reason for that is these meetings are intended to be for you. So please let us know what we can do differently and better to make sure that you're getting your needs met. And also recognize that there are a wealth of resources, which I'll be discussing later in the call, that the Lung Association has available to you, and maybe we can help you find those. And just making sure that the questions that you have about your chronic lung disease can be met. So I want to talk a little bit about the agenda today. Our session title is Understanding Interstitial Lung Disease. We really want to make sure that you recognize what the term is and subtypes. We want to touch on treatment options, talk a little bit about self-management strategies, and also throw in some tips for communicating with healthcare providers about interstitial lung disease. There'll be a little bit of time for discussion and sharing towards the end, but really we want to focus primarily on sharing information with you, so we might not get to your question, but you're welcome to throw that in the chat if you'd like as we go. And we'll cover it during the meeting if we're able to, or if we don't get to it, then we're going to help you. Again, we can reply via email using the email that you used to register and make sure you get your questions answered. So now I look forward to turning the presentation over to my colleague, Mark. Mark's going to introduce himself. He works at our Lung HelpLine, and he could tell you a little bit about what that is and also jump into interstitial lung disease. So go ahead, Mark. Thank you.
Thank you, Bev. My name is Mark Courtney. I am a manager with the American Lung Association Helpline. I've been a respiratory therapist for 30-something years, and I've been with the Helpline for the last 22 years. Let me just start here. Interstitial lung disease, it's kind of a confusing topic because there's a lot of terminology that doesn't make a lot of sense. It's really an umbrella term for a large group of disorders that happen in this particular part of the lungs and cause inflammation, swelling, and can lead to scarring and fibrosis of the lungs. There's actually a couple hundred different types of diseases that can be classified as an interstitial lung disease. If you think about it, and this is something that is referred to all the time, the lungs are often called tracheobronchial tree, and that's because the structures kind of resemble an upside down tree. So if you flip the lungs over, the base of the tree and the trunk is the windpipe trachea, and then it branches out into the bronchi, gets directs air to each lung. It gets smaller and smaller until it ends in the tiny air sacs that are called alveoli. And it's really if you looked up a definition in a medical journal of what an interstitium is, it would say it's a fluid-filled space between a structural barrier. And what that means is the fluid is the blood circulation through the lungs, and that barrier. So when you think of the interstitium of the lungs, then think of that whole thing. It's called a alveolar capillary membrane. It's a bed of air sacs in close contact with the tiny blood vessels in the lungs. And to give you an idea of what the size is, and we really think of that as kind of the leaves on the tree, the tiny air sacs. Sorry, I forgot to throw that in. But if you to get an idea of how small we're talking, the blood vessels that go through the lungs are so tiny that the red blood cells have to actually flow through their single file. So it's a very, very tiny. We want to get as much of the air we breathe in as close contact with the blood circulating through the lungs in order for gas exchange to happen. And normally it only has to diffuse through the width of one cell. So it very easily jumps over. Oxygen jumps in, carbon dioxide jumps out. That's kind of how it works. That's the functional part of the lungs. That's where the magic happens. The gas exchange occurs. And basically, when you have an interstitial lung disease, that's where it's going to occur. That's where it's going to cause a problem. That's where the thickness, the swelling, the fibrosis can impede gas exchange, specifically oxygen, at least early on. Symptoms of ILD or interstitial lung disease, shortness of breath is the big one. Oftentimes early on, it starts out as what we refer to as dyspnea on exertion, and all that means is shortness of breath when you're active, when you're out doing something. Some people get out of breath, trying to mow their grass or go out to get the mail, something like that. A dry cough is often a symptom. It doesn't always happen, and they're not real sure why. They think it might be the inflammatory component causing the irritation or the dry cough. You can have chest discomfort, fatigue, unintended weight loss. The people that we talk to from the helpline early on, I think the dry cough is probably more of a bothersome symptom than anything else. It kind of affects everything we do in our life, from communicating with others, from eating, from sleeping. The last thing you want to do in the middle of a pandemic is have this uncontrollable dry cough. People will be running from you thinking you're infectious or something like that. And probably on down the line, a more late phase symptom is clubbing of the fingers and toes, digital clubbing. And just to get an idea of what this entails, there is a little test that we do. It's called the diamond sign, and basically what it's a way to check for digital clubbing. If you put two opposing fingers together at the nail and you look up into the light, you should be able to see a little diamond form in between your fingernails, and that the cuticle of the fingernails don't meet perfectly together, and they form that little diamond. And that's kind of a way we detect that. Not really sure why it happens, why the clubbing happens. It's probably related to oxygen level and just a chronic disease. Let's see. There are a lot of various causes of an interstitial lung disease. Dust diseases, we call them, asbestosis, silicosis. There is something called hypersensitivity pneumonitis. It's also known as bird fancier's disease. In the Midwest, where I am, we call it farmer's lung. It's a reaction to farmers breathing in all the stuff that they're exposed to, whether it be moldy hay or chemicals in their farm equipment or implements, and all kinds of dust problems. Autoimmune diseases can cause an ILD, sarcoidosis, rheumatoid arthritis, scleroderma. There is a smoking-related interstitial lung disease called respiratory bronchiolitis. Gastroesophageal reflux is kind of a risk factor for an ILD, as some ILDs, and basically that is, heartburn and regurg. Viral diseases are often can cause or mimic an interstitial lung disease, especially in immunocompromised folks. They can have some unusual patterns in their X-ray and CT scan that will look like a interstitial lung disease. Chemotherapy, radiation therapy, even some cardiac drugs can cause interstitial lung disease variation. Some of the immunotherapy, a rare side effect of that is like a pneumonitis or an interstitial lung disease. And basically, your doctor's job when they first are detected an interstitial lung disease is a process of elimination. They want to eliminate all the known causes, and that's there's a lot of things that they do to run through this, and it leads them. Some people, when there is no known cause, and then they would refer to it as idiopathic pulmonary fibrosis and idiopathic unknown cause. And we'll go on to the next one here. And again, the PF or IPF is the most common of the interstitial lung diseases. There are about 50,000 cases every year that are diagnosed. It's still fairly rare, but it is, commonly you would have 150,000 people battling this every year, with 50,000 new cases being diagnosed. Typically with IPF, we see it in people aged 50 to 70. Again, the same symptoms, the chronic cough, shortness of breath. We can see changes in abnormal chest X-ray and CT scan. And the Velcro sound on exam, that's on a chest auscultation, listening to breath sounds. A way to mimic that, if you have hair that's long enough to put it by your ear, if you put your hair between your finger and thumb and rub it together, that's kind of what we hear when we're listening to breath sounds. It usually happens on the end of inspiration, and we call it crackles, but it does sound a lot like Velcro when you're pulling it off. And here is all the things that your doctor will go through to narrow down the diagnosis of interstitial lung disease. They want to do a thorough history, exam, listen to your lungs, do some diagnostic tests. Pulmonary function test is an important part of it, not only to help diagnose, but also to get a baseline of what your lung function is. And then you would check for pulse oximetry, and arterial blood gas can check for oxygen levels, and sometimes an exercise stress test. Even what we call a 6-minute walk test is sometimes done to evaluate, how well the pulmonary system works under some moderate activity. Imaging tests, chest X-ray, the high-resolution CT scan has really kind of been the diagnostic thing, especially for IPF, because it's a specific form of fibrosis that they're looking for. So it used to be, when I started 20, 30 years ago, we would almost always get a lung biopsy on these folks. Now it's hardly ever necessary because we can see the pattern so much better with the high resolution CT scan. Some of the other tests would be things to rule out other possible causes. Make sure you know what medications they're on, any kind of environmental exposures and that kind of thing. You would need to know to make sure you're considering everything else. And the reason why it's so important is there are so many different treatment options for different interstitial lung diseases. I mean, avoiding allergens, farmer's lung and bird fancier's disease, that's at the top of the list of things that they should get rid of. And a lot of people do pretty well if they're diagnosed early on and they get rid of the allergens or whatever's thought to be causing the problem. Obviously, medications, corticosteroids are good for some ILDs. They're bad for other ILDs. So you want to make sure you know what kind of your doctor's doing all the right things to make sure that they narrow that down so that they are providing something that's going to be beneficial. Oxygen therapy is something that is also, it helps breathe easier. It may not relieve all the shortness of breath, but it's body protective. It helps protect all the other organs in your body from damage due to low oxygen levels. Just by we increase the oxygen availability in the lungs, and more of it diffuses through to the bloodstream, so it can help that way. Pulmonary rehab has been shown to help at all stages, but specifically at more severe stages of an interstitial lung disease, improving exercise tolerance and management of fatigue management. It takes the scariness, some of the anxiety out of it when you know you're doing it in a controlled setting so that people are monitoring you. And also there are some people that may need to consider a recommendation for a lung transplant. Usually most of those folks are in the more irreversible part of the interstitial lung disease. The fibrosis is progressive. In those folks, we can relieve symptoms, we can improve the quality of life, and slow the disease progression. Won't get into too much about the medications, but that is kind of what things are considered. It's probably super beneficial to have a good pulmonologist driving that bus and checking off all the boxes to get to a diagnosis. Sometimes if you need a second opinion and there is like a center of excellence or something nearby, then that would be a good place to go as well. That is it with mine. I'll turn it back over to Bev.
Thanks, Mark. So what I'd like to do is take a couple minutes and talk about some of the resources the American Lung Association has to offer to individuals living with an interstitial lung disease. Just piggybacking a little bit on what Mark was saying, there's so many different medications depending on the interstitial lung disease that you have, but some of the things that we've found can be helpful in talking to Better Breathers members is to talk to your doctor about the medication options that you have, and we definitely encourage you to have a conversation about the type of medications that you're on, what the treatment goal is are you trying to cure my lung disease? Are you trying to reduce symptoms? Which symptoms is this supposed to relieve? Are there any less expensive options? What is covered by my insurance? There's a lot we all know that chronic lung disease can be very expensive. There are some patient resources available on lung.org that we can point you to try to help get coverage for some of those expenses. There's also some other tricks and tips that we've learned, such as if your insurance allows securing a 90-day supply of prescription medication, that can save money. Oftentimes mail order pharmacy can save money. There's definitely some options out there. So if you have a medication that you're struggling to pay for, that your doctor has prescribed, definitely have a conversation with your healthcare provider. about what the situation is, because it's not an uncommon situation at all. And then also they and the Lung Association can kind of help point you to some additional resources. But we know that it's not just about medication. Self-management is about a lot of things. So I'm going to touch over the next couple of minutes about different options that you have for helping with your self-management of your lung disease, relating to emotions and nutrition, physical activity, tobacco-free environments, deep breathing, and then ways to find support. So let me jump into some of these topics for you. The Lung Association has a wide scope of resources available on lung.org, and you can go to lung.org/PF for pulmonary fibrosis, and that will lead you to a bunch of different topics and resources available, including handouts about what pulmonary fibrosis is, with some specific diagrams. We also have videos of healthcare providers and also patients who are explaining pulmonary fibrosis in a variety of different ways to help understand and explain, and also so that maybe useful to you if you want to be able to share what pulmonary fibrosis is to somebody else without having to give your personal story. One of the things that I've found is it's helpful if you're trying to explain a chronic lung disease to have some general information that you can share with family and friends so that they get a big picture concept of what it is that you're dealing with, and then you can decide what to disclose about your own personal story. But you can keep things a little bit more separate, like this is the disease and here's my experience with it, so they don't get all meshed together. It's important, and we've had conversations specifically about nutrition and lung disease as part of the Better Breathers Network calls, but I think it's important to at least touch on this, that we all acknowledge that breathing requires more energy for individuals who have lung diseases than those who don't sometimes. And so what that may mean is that an individual with lung disease requires more calories to help replace the additional energy that's exerted when you're working so hard to breathe. So one of the things that your healthcare provider will watch for is unintended weight loss. We know that there are tips and tricks to helping eat more effectively when you have a chronic lung disease. All of the things listed here are options that may work for you, but I certainly encourage you, if you're struggling with that unintended weight loss, to have a conversation with your healthcare provider. It can be really beneficial to request a referral to a nutritionist and somebody who can really talk to you about your own diet and your own disease and help you create a plan to make sure that your body is getting the nutrition that it needs. We have resources on lung.org relating to nutrition, and you can also look up past webinars when we've talked about this. Mark talked a little bit about oxygen, and if you haven't checked out our oxygen resources on lung.org, I certainly encourage you to do so. We have great resources for getting started with oxygen. We have resources and videos and handouts on the different types of oxygen. So if you want to know the difference between a canister of oxygen or a portable oxygen concentrator or liquid oxygen, we've got videos and handouts and web content that can kind of go through all of those different things for you. And also some more secondary topics, like how to travel with oxygen, because there's definitely things you have to think about when you're talking about air travel or car travel, or what to do during an emergency. This is a great topic to be thinking about, whether you live on the West Coast and you're dealing with wildfires, or the East Coast and you're dealing with hurricanes. Knowing what to do when there's a power outage, if you have any sort of durable medical equipment, is a really important thing to have a plan for. And we certainly encourage you to plan for any sort of natural disaster and what your lung health needs are and how they can be helped. I'm going to touch also on physical activity, and we all have our own opinions about exercise, but regardless of how you feel about the word exercise, physical activity is super important for people with chronic lung disease. And so we encourage you to make sure you have a plan to get up and move every day. And then stretching is super important. It helps with balance. It helps with well-being. If you exercise, we know is linked to sleeping better. There's a lot of things that are incorporated when we talk about physical activity and lung disease. We know we've covered physical activity in past calls, so feel free to reference on our website, lung.org/BBN. That's for Better Breathers Network, so BBN. And we have some saved webinars there. But we know that when we talk to Better Breathers members, what we hear over and over again as far as coping skills that help with living with a chronic lung disease, by and large, the responses that we receive relate to physical activity. So that is yet another reason why we really like to encourage, if it's walking or doing an indoor video exercise, going to a class, whatever it is that you find helpful and energizing, definitely be sure to include that in your self-management routine for your chronic lung disease. I didn't touch on, I should go back for just a second. I didn't touch on pulmonary rehab. We're huge advocates here at the Lung Association of engaging in a pulmonary rehab program, and there are resources available to help understand what that is and how you would get involved in that. I know it's a little bit harder right now because of the pandemic, but I encourage you to talk to your doctor about pulmonary rehabilitation if you are not sure how to start on an exercise program, and certainly to talk to your doctor about what your plans are for initiating physical activity, or even if you have a goal but you don't have any plans, and then maybe your healthcare provider can help you think about what those next steps will be to get to a place where you can have goals. So go back to where I left off around breathing exercises. Breathing exercises are intended to help you practice deep breathing, which helps relax your mind and your body. We have a couple different deep breathing exercises available on our website, again, at lung.org/BBN, Better Breathers Network. And these videos go through pursed lip breathing and also belly breathing. You can practice along with the videos. You can tag them so that you can practice them later. One of the things that I've learned from attending support groups is that you really want to practice breathing exercises now, or like when you're not having a harder time breathing, so that you can pull back to that when you are struggling to breathe a little bit, because it's kind of like that old adage of, telling people to calm down, and that's never really worked, because people who are upset don't calm down because you tell them to calm down. You don't want to learn how to use deep breathing exercises when you're already trying to catch your breath. But practicing every time you hit a red light is a great example for me, because I'm not very patient when I'm driving sometimes. So I try to think of a red light as an opportunity to take some deep breaths and practice that skill. We've also covered in previous calls managing mood and emotion. It's really important to have coping strategies. Living with a chronic lung disease can be really hard. And so knowing what tools you have in your toolbox already and exploring what works for other people can be really useful. Sometimes that means self-talk. Sometimes that means attending support groups. The Better Breathers Clubs are support groups that are located around the country of individuals who convene together usually once a month and talk about different things relating to chronic lung disease. If you haven't been to a Better Breathers Club, again, the pandemic has kind of thrown this for a bit of a whirlwind. Some of the clubs are meeting virtually, some are on pause. But I would encourage you to look on our website, lung.org, and see what Better Breathers Clubs are near you. And then you could connect with one of those groups or keep joining these calls. But anything like getting out in nature or journaling are really important. We have online support groups through our Inspire community. If you haven't checked that out before, you can get a direct link to that through our website. And that's a support group for people We have a support group for people living with pulmonary fibrosis, and we also have a support group for people caring for people with pulmonary fibrosis, because we know that caring for those living with chronic lung disease can also be challenging. We also have more general communities like living with chronic lung disease, if you're not interested in a group that's specific to pulmonary fibrosis. So I shared a lot of resources verbally with you, but again, I want to just encourage you to check out lung.org/PF for pulmonary fibrosis. We have so many resources, and I touched on a couple of these. We have information about lung transplants, the research that we're doing, clinical trials, and how to get involved. We have information on the different topics that have been covered, and then so many more items as well. But just surrounding yourself with as much information as you can is super helpful, and we've found to be a super useful way in making sure that individuals are getting the information that they need. Mark was kind enough to walk through what interstitial lung disease is. Mark, I know you're still on the line. Could you talk us through just briefly what the Lung HelpLine is and how individuals would contact the Lung HelpLine if they have any questions, and then you can kick it back over to me for questions?
Absolutely, Deb. We are the medical resource. The people answering that medical call line are nurses, respiratory therapists. We've had anesthesiologists and pharmacists work with us too. So we have a wide variety of skill mix there, and really we're just here to provide solid information, answer questions, find resources, to help you with things like that. I mean, I can't stress enough what Bev was talking about with our online communities. When you look, if you have access to the internet, you already have access to just tons of information about the lungs and lung disease. But I think the question that a lot of patients ask is, what does it feel like? What do I have to look forward to or not look forward to as this disease progresses, or what's it like to be worked up for a lung transplant, that kind of thing. You can find all that stuff on the online communities, and they're super helpful people that will offer their time and share all that information with you. It's such an easy format to do it. I mean, there's no reason not to. Everything is private and nothing's shared. So you're free to do that as much as you can. We have several ways you can get in touch with people at the helpline. We have an 800 number, and you can call the 800 Lung USA number. You can call 800-548-8252. That's our other medical helpline number. We have a chat line that you can do a medical chat and ask some quick medical questions. We get a ton of COVID-related questions, obviously, at this time that we're living through. But we're happy to talk about any of those things and point you in the right direction. And you can also go on lung.org and send us an email through the question format on the website. And we try to prioritize and get answers. Obviously, we can't provide medical advice. We're not physicians. We don't see or treat anybody, but any kind of questions or concerns that you might have that we can help, we're glad to help and throw any kind of resources that we know of at folks. I mean, I think it's a great. I like the variety of it because you never know what people are going to have questions about, and it's like a big open book test for me because I get to research things that probably wouldn't be something I'd see on a day-to-day basis. So I really enjoy it. So
Awesome.
as we get some questions.
Great. I think all of the questions that we've received so far, we're going to be following up on individually just to make sure that we're adequately responding to those questions. going to be sending out a survey to everybody who attended today. So feel free if you have any lingering